Hi guys, welcome to Target PEBC Prep. My name is Mohit Koladia and today we will be discussing an important chapter, that is cholinergic drugs. Okay, so let's start with the cholinergic drugs. So this is again a very important chapter from the pharmacology point of view, from the PEBC point of view. So basically cholinergic drugs means those drugs that are parasympathomimetic, okay, so they are parasympathomimetic, they mimic the action of parasympathetic system, right? And the main molecule, the endogenous molecule that we need to remember here is acetylcholine. Alright, so basically cholinergic drugs can be divided or studied in two ways, or it can be classified as direct acting or indirect acting. Okay, so we'll study it into two divisions, the direct acting ones and the indirect acting ones. So what are direct acting ones? So let's see with a drawing here. So say this is your neuron, it's releasing ACH here. This ACH, that is acetylcholine, could work on post-junctional receptors, which could be muscarinic receptors, right? It could be muscarinic receptors or it could be nicotinic ion channels. So this acetylcholine can bind to muscarinic receptors or nicotinic ion channels. So in direct acting, this acetylcholine or the agents, that is cholinergic drugs, those will directly act on receptors or nicotinic ion channels. In indirect acting, the drugs do not directly work on the receptor. They basically increase the concentration, right? Increase the concentration of acetylcholine. So how do they do that? So you have in this synaptic region, there are different choline esterases, acetylcholine esterase, right? What these enzymes do is basically destroy this acetylcholine, and so there is no further acetylcholine available to act on this receptor. So these indirectly acting agents, they block this, they block the effect of acetylcholine esterase and increases the level of acetylcholine. So more acetylcholine is available to work on this receptors. Okay, so now let's first start with the direct acting agents. Okay, so the direct acting cholinergic drugs, please understand this very nicely, so you know your life becomes easier later in the pharmacology, because you have to understand this drugs very well, all the drugs of autonomic nervous system, be it cholinergic or sympathomimetic drugs. So the direct acting could be divided as the one acting on muscarinic receptors, or it could be the one that is acting on nicotinic receptors. So the ones acting on the muscarinic receptors is really important. So chemically that could be divided into two parts. One is the choline esters. So these drugs are basically made of esters of choline, and the other one is the alkaloids or plant derived. Okay, so the examples to remember here is, first one very important is acetylcholine. Okay, the another important drug to remember is here is methacholine, We'll discuss each of this drug later. The another important one is the Carbaclo, and fourth one is the Methacholine. Okay, and in the alkaloids, basically you have muscarine obtained from the mushroom. The another one is the Pillowcaffeine. Alright, so just remember these drugs for now, and we'll discuss each of this now. So let's start with the choline ester first. The very important one is acetyl choline. Okay, so the main points you have to remember here: it's not used clinically. Why? Remember the reason. Okay, it is not used, or it is never prescribed clinically. First of all, it's an endogenous molecule, but the reason why it is not used clinically is because it has very short duration of action, short half-life. Okay, short half-life, typically in seconds. So as soon as you give this drug, it's readily destroyed or eliminated from the body. So why does this occur? Because when you give this drug in the blood or in the plasma, you have butyryl choline esterases. So remember this could be an important question. Butyryl choline esterases, which destroys the plasma ACH or acetylcholine. Okay, so it destroys your acetylcholine, and so the half-life is very short. And the another reason is, even if you give high concentration of acetylcholine, it would have a diffused action throughout the body. So what do you mean by this diffused action? So it's spread throughout the body, like you don't have a specific action that we need as a therapeutic drug, but you will get increased parasympathetic activity throughout the body. So it's very non-specific action, right? So you cannot use this drug medicinally. Moreover, the another reason is it is a highly polar compound. Okay, because of being polar, it is less lipid soluble, and because it is less lipid soluble, it cannot cross any biological membranes like the blood-brain barrier, so it could not have any CNS effect. So basically you don't use acetylcholine as your therapeutic agent. Okay, just remember this. Now let's discuss Methacholine. This is a very important drug. You have to remember, because it starts with B, the easier way to remember it activates bladder and bowel. Okay, so basically the main effect of this drug is to increase urination and increase GI motility. Okay, so the main use of this drug is you give it in a post-operative urinary retention or postpartum, like post-pregnancy. Okay, so you basically give after operation, when you have surgical procedure. Sometimes your bladder muscles do not work properly, and after pregnancy there is urinary retention. In those conditions you give this Methacholine drug. So the important thing to remember here is, whenever you prescribe this drug, the type of retention of urinary or bowel, it should be non-obstructive in nature. So basically it should be non-obstructive. Okay, you cannot give it in all conditions. It should be non-obstructive, because if you are, say this is your bladder, maybe it's like, if there is a blockage here and if you give this drug, it kind of creates a pressure and you could have a high pain. Okay, the patient could have a high pain and he will remember you forever for giving this drug. So please do not give in obstructive conditions. So it should be always used in non-obstructive urinary or bowel condition. Okay, just remember this. Now the main difference here is to remember that this drug has strong muscarinic action only. Strong muscarinic action. Okay, so Methacholine, it has strong muscarinic action. So the basic difference here between Methacholine and acetylcholine is acetylcholine has quaternary amine structure plus a negative ester linkage. Okay, so this makes it prone to hydrolysis of this ester bond by choline esterases. Okay, but Methacholine, the acetate group in Methacholine, the acetate group is replaced by carbamate. So because it has carbamates, this is less resistance. Okay, carbamates, and it also has a methyl group addition. Okay, so what happens is this carbamate group provides resistance to hydrolysis by esterase, so you cannot easily hydrolyze this drug, and hence this has a longer duration of action. And this methyl group, it basically gives the selectivity to muscarinic receptors. Okay, muscarinic receptors. So just remember this, that methyl group in all cholinergic drug, it gives selectivity to the muscarinic receptor, and this carbamates, it gives resistance to the hydrolysis by acetylcholine esterases. Okay, so where could you use these drugs? In post-operative urinary retentions or postpartum urinary or bladder retention. Okay, or whenever there is an atonic stomach, you can use this. Like there is a paralysis of GI muscles, in that case you use this drug. Okay, so the main side effects of this drug to remember. Okay, let's remember the side effect. So when you have Methacholine, you increase the cholinergic activity in the body, right? So you have sweating. So the side effects could be sweating, you could have bronchoconstriction, right? All bronchoconstriction, salivation, all these are side effects of Methacholine. Just remember this, all increased, you are increasing basically the cholinergic system. So increase all the symptoms of increased parasympathetic system is basically the side effect of this drug, like sweating, bronchoconstriction, salivation, lacrimation, or flushing, etc. Right? Okay, another important thing, you could remember is the contraindication. When this drug is contraindicated in peptic ulcer. In peptic ulcers, this drug is contraindicated because in peptic ulcer the high parasympathetic activity could lead to increased acid secretion, right? So that is not really what we want in peptic ulcer. So this is contraindicated in peptic ulcers. It is contraindicated in COPD, chronic obstructive pulmonary disorder, because of bronchoconstriction, right? You don't want bronchoconstriction in COPD. Then it is also contraindicated in ischemic heart disease, okay, because of bradycardia due to parasympathetic system activation. It is also contraindicated in hyperthyroidism because this could convert, you have atrial flutter, right? In hyperthyroidism, that could be converted into fibrillation, and that could be dangerous for the patient. So you do not give B-ethanol in hyperthyroidism. Again, this is contraindicated in Parkinson's disease, right? Because in Parkinson's disease, basically what happens is there is a balance of dopaminergic and cholinergic system, but in Parkinson's disease this dopaminergic system is degenerated, so there is less dopamine and increased ACH, right? Increased ACH and decreased dopamine. So if you are giving more acetylcholine because of this drug increasing more acetylcholine level, this could cause tremors in the patient, right? Because this increases the level of ACH inside. So if you have more ACH, there will be tremors like side effects. So you do not give this drug, okay? Now let's come to the next important drug. The next important drug is Carbaclo. Okay, let's discuss Carbaclo. Now Carbaclo has carbamate group but no methyl group, okay? There is no methyl group. So what would happen is this will be resistant to acetylcholine esterase, but because it doesn't have methyl group, it will work on muscarinic plus nicotinic receptors, okay? So this will have action on both. So it's non-selective basically. It's not used systemically. Okay, only used in sometimes in eye conditions when you have miosis or ciliasis. Okay, basically you use it to decrease the intraocular pressure in glaucoma. So I'll explain this in a separate video, so please keep me reminded for this. I'll put another video making sure that you understand what intraocular pressure and glaucoma pathology is, okay? So you have to decrease intraocular pressure in glaucoma, and it is only used when pilocarpine doesn't work, okay? So when pilocarpine is not working in some patients, you use Carbaclo, but pilocarpine is the main drug that is preferred in glaucoma, okay? Pilocarpine is preferred, not Carbaclo. Now another very important drug is Methacholine. So Methacholine basically doesn't have important use, but the very important thing to remember, it is used in challenge test, asthma challenge test, okay? Asthma challenge test. So what happens is, basically in some patients you have hyperactive or hyperreactive bronchial muscles. Okay, so when you give this drug, because of this hyperactive bronchial muscles, there is already bronchoconstriction. So when you give this drug, a methacholine, it will create further bronchoconstriction. So it causes further bronchoconstriction, and thus we deduce or we come to a conclusion that this person has asthma. Okay, so in hyperactive bronchial muscle test, you have an hyper bronchoconstriction, but when you give this drug methacholine, it creates further bronchoconstriction, and hence you confirm that this patient has asthma. So while doing this test, make sure you have bronchodilators immediately with you. Okay, you have to keep bronchodilators with you. Now why methacholine is used? Because it has short duration of action. Because of its short duration of action, it is used in asthma challenge test. Okay, so it's hardly like 5 to 10 minutes that the person might have trouble, but with other drugs, because of the longer duration of action, you can't use that drug in this asthma challenge test. But methacholine is the preferred drug for asthma challenge test. Now let's go to pilocarpine. So this is a very important drug. The main use is in open and closed angle glaucoma. So I'll make another video of this glaucoma pathophysio. You need to understand what is the open and closed angle. So just remember right now that pilocarpine is used in open and closed angle glaucoma. Okay, the another important condition where this is used is xerostomia. So this is dry mouth condition. So what happens is, when the person has a cancer and other disorders, in which they receive the radiations, radiation causes this xerostomia. Okay, dry mouth condition. So person's mouth is dry. So in that case, you use pilocarpine. It stimulates the parenchymal cells or salivary glands to increase the saliva in your mouth. Okay, so you use in xerostomic condition. Another condition where you use this is Sjogren syndrome. In Sjogren syndrome, this is an autoimmune disorder where you have antibodies which destroys your salivary and lacrimal gland. Okay, so it causes a dry mouth condition. So you destroy your salivary glands due to the antibodies. So this is a Sjogren syndrome. In this Sjogren syndrome, again pilocarpine is used to increase wetness in mouth. Okay, also another important use of this is to reverse the atropine induced mydriasis. So in atropine toxicity, it is used to reverse the mydriasis condition. Okay, so that finishes with the direct acting cholinergic drugs. Thank you very much for listening or watching to my lecture. Please like or subscribe my channel. Thank you.